Jay is a middle-aged man who woke up in the middle of the night with this crazy pain and inability to urinate. As he sat on a toilet seat, sweating profusely and holding his tummy, he felt like there's this swelling in his lower abdomen that is enabling him to push out the urine. His wife, however, thinks he's being promiscuous. That's why he's in this situation that he is. What he has is called benign prostatic hyperplasia. Hi everyone, welcome back to my YouTube channel. I am Dr. Kunle, and today we are diving into an important topic that affects millions of men worldwide: benign prostatic hyperplasia, or BPH, or we just say prostate enlargement. We cover everything under it: the symptoms, how it's diagnosed, and the various treatment options. So let's get started. Benign prostatic hyperplasia is a condition in which the prostate gland is enlarged. This gland is located just below the bladder and it surrounds the urethra, a tube through which the urine comes out from the body. As men age, the prostate can grow larger, potentially leading to BPH. It's important to note that BPH is a non-cancerous enlargement of the prostate. Here are some predisposing factors. The prevalence of BPH rises markedly with age. Most cases are in men above 65 years. Geography. BPH is quite common among blacks and Latinos. Also, genetics. If a father has it, then it's likely that the son will have it. Also, some sex steroids and some hormones, also like testosterone, dihydrotestosterone, and estrogen, can also contribute to say. At this point, I must say that sex, or the frequency of sex, does not increase the chances of a man developing BPH. Other predisposing factors will include the metabolic syndrome and cardiovascular diseases like hypertension and diabetes. Obesity also plays a large role when it comes to this, and then diabetes generally, and poor physical activity. Also, these are all linked. Poor physical activities will lead to obesity and can cause metabolic syndromes. Now let's talk about the symptoms. As you know, BPH can vary in severity, but the common symptoms that arise include frequent urination, especially at night. We call that nocturia. Urgency to urinate. Also, difficulty in starting urination, or sometimes there is weak or interrupted urine stream. There's also an inability to completely empty the bladder. Note, if you experience any of these symptoms, it's important to see your healthcare provider for proper evaluation. Let's now talk about the myths. It's about time I talk about some of the things people think about BPH that is not true. First, some people think that the treatment for BPH can cause impotence. The answer is no. BPH surgery or treatment does not tamper with erection or sperm production, because the prostate gland only produces seminal fluid and not sperm itself. Secondly, some people also think that the larger the prostate, the bigger the symptoms. This is also not true. There is no correlation between the size of the prostate and the symptoms the person will. Also, word on the street says that BPH will lead to cancer. No, BPH is not cancerous. Diagnosis. Diagnosing BPH typically involves a few steps. Your doctor will start with a detailed medical history and physical examination, including a digital rectal exam to check the size and condition of the prostate. Other tests that he may want to do may include urinalysis to rule out any infection, a PSA, that's called prostate specific antigen, to measure the PSA levels in the blood, as elevated levels can indicate BPH or other prostate issues. Also, a uroflowmetry can be done to measure the strength and amount of urine flow. Post-residual volume test is also done to determine how much urine remains in the bladder after urination. Imaging tests that could be done includes ultrasound or MRI to get a detailed view of the prostate and urinary system. These tests altogether helps in assessing the severity of BPH and ruling out other conditions. Actually, the treatment for BPH depends on the severity of the symptoms and their impact on the quality of life of the patient. Here are some common treatment options. Lifestyle changes can come into play, where the patient reduces the fluid intake before bedtime. Reducing alcohol and caffeine which can increase urine production, also plays a huge role. Regular exercise and having a healthy diet is usually a hallmark. Other medications can be used, which includes alpha blockers, which helps to relax the muscle of the prostate and bladder neck to improve urine flow. There's also 5-alpha reductase inhibitors, which reduce the size of the prostate over time. There are combination therapy of both of these drugs that works effectively to give significant symptom relief. There are surgeries that can be done, which are minimally invasive surgeries, which includes transurethral microwave thermotherapy, which uses microwave energy to reduce prostate tissue. We have the transurethral needle ablation, which uses radio frequency energy to shrink the prostate tissue. We have other surgical options, which are TURP, that's the transurethral resection of the prostate, which removes a part, usually a larger chunk of the prostate. Then also, laser surgery can be used to remove the prostate tissue generally, or a prostatectomy in severe cases where the symptoms are so debilitating, which may include removal of parts or every part of the prostate. Each treatment has its own benefits and risks, and the choice depends on the individual circumstances. It's important to always discuss with your healthcare provider to determine the best option for you. Thank you for joining me today to learn about BPH. Remember, if you know someone or you yourself is experiencing these symptoms, it's important to seek medical advice. The diagnosis and treatment can greatly improve quality of life. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to my YouTube channel for more information and health related content. Stay healthy, take care.